Hi, I'm Shane Lawler. Our team has been helping families transition into aged care for over 15 years. There are several different fees. For this discussion, we will assume that the potential resident has been assessed by Centrelink and is required to pay a refundable accommodation deposit, known as a RAD. However, a resident who is classed as low means via the Asset and Income Assessment form, which I have discussed separately, will not be required to pay a RAD, but they may need to pay a daily accommodation contribution. This is known as a DAC. Confusingly, there are RADs and DAPs and RACs and DACs. I don't know who came up with all the names. I have discussed a RAD separately. However, it is a large sum of money and generally ranges from $300,000 to $800,000. Every aged care home room has its own set RAD. If the RAD is not paid, then there is an interest-based fee charged against the unpaid RAD. It is called a daily accommodation payment, known as a DAP. So if you pay none of the RAD, you have to pay the DAP based on the full amount of the RAD. But if you pay half the RAD, you only pay half the full DAP. The interest rate is set and fixed at the time of entry by the government. Then there is the basic daily care fee. Every aged care resident pays this no matter what level of assets and income they have. The rate for the basic daily care fee is calculated at 85% of the full Australian age pension. This rate applies for both single residents and couples, as every aged care resident comes under the financial assessment rules for a single person. The basic daily fee may increase each year in line with any changes to the age pension, and it's adjusted twice a year on the 20th of March and on the 20th of September. There is also a means tested fee. This is a fee calculated by Centrelink according to the assets and income of the person going into care. I have also discussed this separately. There may also be an additional service fee, possibly called an extra service fee or maybe a club services fee. Aged care homes have different terminologies for this fee. Essentially though, it is an additional amount the aged care homes are allowed to charge for providing additional services. This fee generally ranges from $10 per day to up to $150 per day, but $30 a day is quite common. Generally this fee is not an opt-in or opt-out. It is part of the structure of that particular aged care home. It is important to note that some aged care homes do not charge this extra fee. Yes, the aged care home may negotiate on the refundable accommodation deposit and extra service fee, depending on how many vacancies they have at the time and other issues. However, it is really important to note that sometimes reducing the RAD may actually be financially worse off than paying the advertised RAD, because that would mean that there may be more funds left in the bank account, and depending on the resident is being assessed under the assets or the income test, this may decrease age pension and DVA age pension, and also could increase the means tested fee. We would do the calculations before we would discuss with the aged care home a lower RAD. For complimentary and no obligation discussion on how we could help you, please contact my office or click the link from my website. Also, please subscribe to our YouTube channel for more tips and information on aged care financial advice.